Hi, this is Trainer David coming at you. I'm over in Portland, as you can tell from the nice picture of Mount Hood. Okay, quote of the week. The top salespeople are usually the ones with the most activity. It doesn't guarantee that you will close more deals, but if you have no activity, you won't be closing any deals. Okay, so isn't that true? Thank you, Colleen. Okay, so here's kind of what we'll be doing. We've got the tip of the week, some sales shout outs, and then we'll just do like a brief introduction into what Medicare Part A and Part B really do for people. Okay, now this is kind of, well, I'm one of the Medicare instructors, so we'll always kind of stick with the Medicare theme here today. But this is kind of really new, and this is really a big deal. For 2021, Medicare Advantage plans will cover ESRD. In the past, if you had ESRD, you could not purchase a new Medicare Advantage plan. Okay, if you were in a plan already and got ESRD, you were covered. But if you, one of the reasons for going onto Medicare is that you do have end-stage renal disease, but you were prohibited from purchasing a Medicare Advantage plan. Big change for 2021 is those persons will be able to purchase an Advantage plan now. Kind of what's been selling here. We're looking at the, last week, it looks like that for short-term plans, it was the NatGen. Limited medical, still golden rule. The accident plans, though, we're back to NatGen. Critical illness and dental seem to be the ones that the people are selling is golden rule. So you can see it's kind of a mixed bag there. I know some people will sell all golden rule and some people will sell all NatGen, but I think some of our top people will always be doing that kind of a combination, putting together, the best for that person in the area that they were in. Kind of see our sales leaders down there for short term, Max and Sean. For limited medical, Timothy and Arthur. Again, kind of for the accident, you see Max because he's pairing that up, as is Timothy with his limited medical. Now over on the Medicare side, looks like Donna and April were like really leading the way for Medicare Advantage plans this last week. Okay, so we're just kind of jump right in here and talk a little bit about Medicare, one of my favorite topics. And I always just kind of start off with that, what is Medicare? Now, the thing about Medicare is that once somebody turns 65, it's the only game in town. Medicare is a federal health insurance program administered by the Centers for Medicare and Medicaid Services. You always hear that referred to as CMS. But once you turn 65, this is it. This is all that's going to be available to you. There's things that you can do to supplement it. One little exception to that rule, though, is if you're employed, you can not go on Medicare, but you can stay in your employer group plan. But you cannot decide that you want to go now and get a major health policy or a short-term policy. None of those are available to you now. It can only be Medicare Part A and Part B. Maybe some hospital indemnity out there, but I think even most of those are made to supplement, your Medicare. So usually they have that prerequisite of having A and B. So what is A and B? Well, these are actually the 4 parts of Medicare. And Part A is your inpatient hospital cost. But as we're going to see, it's really much more than that. And Part B, that's your physician and medical cost. Okay, so by what they're talking about there is that's the doctor and then anything else that goes with it. That could be lab work, that could be a monitor like for a diabetic, and test strips. In fact, it could even be things like flu shots. Okay? You have to be careful with the shots though, because some of those are Part B and some will be Part D. You gotta look out for that. Now, Part C is that Medicare Advantage plan. And then Part D deals with prescription drugs. But here today, we're going to break down that Part A a little bit for you. Now, we always say that it starts off with, covering you for your hospital. But like I said, it's more than that. It also is going to include things like your skilled nursing facility, hospice care, and in some cases, there's even going to be some home health in there. Okay? But when it comes to that hospital insurance, it's you have to be admitted to the hospital, and I want to emphasize the admitted because we all know how observation works, right? You're not admitted to the hospital, but you're held for observation. So that is not covered by Part A. That's going to be covered by Part B. And the significance is what your costs are, right? So, like I said, it's also going to be skilled nursing facility. Now, to go into a skilled nursing facility, there's one of the, some key things. Of course, the doctor has to certify that you need the care from a skilled nursing facility. But one of the key things, and this is what bites a lot of Medicare recipients, is that in order to be covered by Medicare in a skilled nursing facility, you had to have spent 3 consecutive days as an inpatient in the hospital. Okay, so you can go from the hospital and then go after 3 days, you could be transferred to a skilled nursing facility, and it's all being covered by Part A. If you don't have the 3 days, Medicare doesn't cover it. I always like to point out that that also means that if that somebody is using that Medicare supplement, it only covers what Medicare covers. So if Medicare didn't cover it, that supplement won't cover it either. So that's a hard requirement, that 3 days. And maybe that person goes home first. Okay, they don't go directly to the skilled nursing facility. Well, so long as they have the 3 days in the hospital and no more than 30 days after discharge, they still meet that qualification to go to the skilled nursing facility. And of course, it has to be a Medicare approved one. But, there's some home health. This is what saves a lot of the people who couldn't, they didn't meet that qualification to go into a skilled nursing facility, but they still needed some of those type services. So they can get that at home. So that's why you see here intermittent skilled nursing care. And this would be where a nurse comes to that Medicare recipient's home and provides that care. It's not going to be the same. They're not going to be there 24/7 or anything like that. But you can have the doctor come in, or excuse me, the nurse come by, and maybe they're going to do something like change bandages or administer some kind of medication that that they can't do at home normally. Like maybe some kind of a shots or something like that. Or maybe they just need physical therapy, so the physical therapist can come to the home and do it. Or some of these other kind of occupational and speech therapy things that could go. In order to get that though, again, it's got to be certified by the doctor to be medically necessary. And they'll just come to their home and do it. So that's the big alternative for those who didn't have that 3 days in the hospital, but maybe had an emergency room visit or something like that, or maybe just a day or two in the hospital and were sent home. So they still needed some sort of nursing care, but they didn't need the full nursing, skilled nursing facility type care. And the last part is that terminally ill. Okay, for those folks, I always like to use a lot of caution with that, because for somebody who to accept the hospice, you just do need to know that any attempt to cure the disease that a person has ceases. You can't do that type of care in a hospice. So it's all going to be around making the person comfortable. And I mean, they'll cover the things that are not related to the terminal illness, but they're not going to try to, if you had, cancer, they're not going to be now sending you off to chemotherapy and all radiation. They're going to, all of that is stopped. Okay, so you're going to be terminally ill in there. Now, as a side note, my daughter did work in one of those. And so they did have people from time to time that did get left, that did, get out of there. But for the most part, they are terminally ill. Got a question here that's asking about if you can have a copy of the PowerPoint. Okay, it will be posted to the training, library. But if you email me, I can, get a copy of it over to you if you need to see it. Have it on your own computer. Yeah. I can help you with that. Let's get back here. Okay, before we get, just a couple of things though about Part A. Now, I always like to let you know the cost in here, because for most people, they will get Part A when they turn 65 without having to pay a premium. I always want to caution that. I don't want you to think that Part A is free. Most people who have qualified for premium-free Part A, it's because they've already paid for it. And if you go back to your pay stub and you look on there and it says Medicare, that was paying for Part A. So most people have paid for it already. So if you had to buy it, because there are a lot of people who, for whatever reason, they could be an immigrant to the US, and then once they turn 65, remember there's nothing else you can buy, but they never contributed long enough to get Part A premium free. Well, they're going to have to pay for it. And the other ones that I've run into from time to time are the trust fund babies, people that just never worked, they had a trust fund. Well, when they turn 65 and they went to Medicare, they now have to pay for that. And that cost is $458 a month for Part A. Now, if you did work some and you got maybe 30 quarters, because it takes 40, but if you got, once you reach like between 30 and 40, it's $252. And then once you've got the full 40 quarters, it's zero. And I've talked to many an immigrant who stayed working beyond 65 so that they could get the number of years or quarters so that they qualify for Part A at free. And the other thing about Part A is that when you do use it, there is a deductible. And the deductible on Part A is not an annual deductible. It's an event. The way that it's put together, it's an event. And so for a hospitalization, the deductible is $1,408. And so you would look at it like this. Worst case, the way they've structured it is you could pay that 4 times in 1 year. Okay. But the way it's designed is if you have an event, it puts you in the hospital, you pay your deductible, everything is covered after that. And then if you go home, if within 60 days of being released, you're back into the hospital within the 60 days, it's still covered under that initial deductible. But if greater than 60 days after your release, then it's considered new and you pay the deductible again. Okay, so it can get pretty expensive. Like I said, worst case scenario would be 4 times in 1 year. Okay, so now we'll just kind of move on over to Part B. Part B is going to help with the physicians and medical stuff. And like I said before, it's going to be more than just that. I mean, Part B is going to help pay for doctor visits, outpatient services. A lot of times people go in for surgery, but they do it as an outpatient. That's known as outpatient surgery. It's going to pay for durable medical equipment. Maybe you need a CPAP machine or a wheelchair, something like that. It's going to pay for that. X-rays, lab tests, ambulance services, or all those things are going to fall under Part B. Now, they look at Part B as 2 types of services. There's going to be things that are medically necessary. That's the services or supplies that are needed to diagnose or treat your medical condition, that accept the meet the accepted standards of medical practice. Okay. Then there's the preventative services, and these are healthcare to prevent illness. Okay, that's where you see things like the flu shot. There's a list of all the cancer screenings that are covered by Medicare. So it's very similar to what you see on the under 65, but they don't call it like going in for a physical in Medicare. They call it a wellness check. So you have to go in for your annual wellness check. Now this is kind of a list here of all of those things that they're going to be screening for when you go in for your wellness check. Okay. And so I always like to point out a few things in here, and it's very similar to the under 65. You see here that if I get down to, colorectal cancer and screenings, that I can get a screening colonoscopy. All of these things on here are at 0 cost. In other words, you don't pay a copay or anything on Medicare. But what I like to point out is that's the screening. And they're very particular, just like most other plans, that on the colorectal, let's say you go in and they find something and they correct it. Well, that's not a screening anymore. Now that's considered to be a diagnostic after that. And so that's going to be move you over to the copay side of things. Because once it's as long as it's a screening, in other words, they never found any problem, then they continue to do it at no cost. Of course, you're probably on a 10-year schedule at that time. Probably don't see more than 2 or 3 in a lifetime. But if you have like polyps removed and all that, and they want you to come back in 2 years, that becomes diagnostic and it's no longer screening. So just kind of be aware of that. So here's kind of the way Part B premiums work. For most people, it's going to be that $144.60. Now that is the one here for 2020. It typically goes up every year, just a few bucks, but that's the 2020 premium. But you notice that it says $144.60 to $491.60, and that's because it's based on your income. So if you have a higher income, you could wind up be paying more for that. And as a side note on that, the way that they look at income is your tax return from 2 years ago. So I've seen more people come in with a big complaint over, they're charging me more than the $144.60. I don't make that kind of money anymore. Okay, well, they're looking 2 years ago, and it turns out on the ones that I've dealt with, they took a severance, and so they got a big severance that year, and now their Medicare is caught up with them on that. So there's also a Part B deductible. That Part B deductible is $198. It can change each year, and it usually goes up a little bit each year. But after you meet that deductible, then it's 80% of all the charges. Okay, And there's a lot of little ins and outs with that. But we don't really have time to really go over that part today because this is just a little Motivation Monday one. But you're going to be paying 20% of the cost. So as I used to tell people, is that if you could find a doctor who would see you for $100, your copay would be 20, okay, 20%. In Medicare, the doctor is going to collect that copay at the time of service. So key thing to remember there, okay? There's no maximum out of pocket. So that means that if you need that $100,000 surgery, your share is $20,000, and they're going to want you to pay that at time of service. So that's why most people wind up with some kind of supplements, because while it will help and you're fine if you're pretty well on straight Medicare, most people don't want that liability. Okay, so that's kind of just a quick down and dirty on parts A and part B. Later on this week, I believe it is on Thursday, we'll really go into part A and part B if you're interested in Medicare, and kind of really break that down quite a bit and really look at all the ins and outs and why people would want some kind of a supplement. So we'll take some time for some questions. If anybody has any questions there, just go ahead and chat them over to me, and we'll just answer that for you here. And then in the meantime, I guess is that Louise, I will get that back. I'll get that out to you. Okay. I will talk to you later. Have a great Monday and good selling for the rest of the week. Hope things go well for you.